So, good evening, everyone, and welcome to Candid Conversations session. This is something new. What we tend to do in our conferences is that we tend to discuss a lot about academics from stalwarts and seniors in our specialty. But apart from academics, there are a lot of things to be learned, and we tend to miss out on those. So, to learn from the journey of our seniors, our teachers, and the stalwarts in our specialty, we've started this candid conversation sessions. And here, what we are going to do is we are going to have a purely informal session. We will be discussing nothing about plastic surgery, everything else apart from plastic surgery. We will discuss about the achievements of our stalwarts. We will discuss about their failures, the challenges they overcome, and we will learn from them. So, in our today's session of Candid Conversations, we have with us Dr. Visweswar Bhattacharya, sir. He obviously needs no introduction, but just as a formality, I'll introduce him. He is, as we all know, the past president of the Association of Plastic Surgeons of India. He has been awarded the Plastic Surgeon of the Year award by the APSI. He has been awarded the Eminent Teacher of the APSI, eminent teacher of plastic surgery by the APSI. He has been given the Lifetime Achievement Award by the UP and the Uttarakhand Association chapter of the APSI. He has been intensely involved in clinical and basic research since even before I was born, since 1972, 73, 74, that time. And he has created a wonderful documentary. I believe you must have all seen on Sushruta. His talks on the microcirculation of the fascia is phenomenal, and I'm sure all of us have heard it many times. He is one of the few plastic surgeons who has done PhD in plastic surgery, and obviously has been given numerous orations. So this is a very long introduction. It will be a very long introduction. So I'll stop myself right now, and we will begin with our candid conversation sessions. Sir, welcome to Plastic Surgery Education, and welcome. Thank you for agreeing to this candid conversation sessions with me.
Thank you, Dr. Nikhil, for having me this afternoon. And I appreciate your endeavor to this new journey. And I'm sure it will be a grand success for all of us to
Thank you.
learn from each other. And I'll try to respond genuinely to my best.
Thank you, sir. So to begin with, sir, can you tell us something about your journey from probably you are the first batch of MCA students, one of the first batch of MCA students in the country. So can you tell us about your journey from entering the medical school to being the first batch of MCA students to becoming a full-fledged plastic surgeon?
Well, I joined MBBS in 1967. And after qualifying in the All India test, and there used to be a pre-medical course of Banaras Hindu University. 50% seats were filled from that and 50% from All India Institute. Luckily, I qualified in both, and I opted for All India post because then the next friend of mine could have gone into MBBS. So I left that space for him. Um, then I started my graduation in the Institute of Medical Sciences. At that time, it was College of Medical Sciences. It became institute in 1971 when I passed out. So Professor K. Udupa was the Padma Shri Professor K. Udupa, the founder director, and he was an workaholic and absolutely ideal for most of us, the teachers and students. So he was the driving force. And then after graduation, during my graduation, I appreciated the all the teachers, but especially the surgeons, because they were, as I was young, looking more smarter, well dressed, and outstanding their own colleagues in most of the places. So, and during our training, I was very much inclined in surgery. Another reason is that Professor Murari Mohan Mukherjee was a very close friend of my father. They stayed together in London, and he has seen me one day old. I was born in London. So my father used to say, I want you to see as another Murari Mukherjee. I said, that is very difficult, but I can become a surgeon. So then I had no other option in my mind except that I'll become a surgeon. So I joined surgery MS in 1973 after graduation. And then I rotated in various departments and subspecialties. And plastic surgery always impressed me.
Mm.
Now, what happened is that though I wanted to become a plastic surgeon, but I never uttered at the level of MS general surgery. A moment came when Professor M. Mukherjee came to BHU as an expert for a selection committee in 1974. And while returning, myself and my father were driving with him to Moghalsarai station. And in the meantime, he asked me, so you are doing MS, what is next? What you are going to be? I kept quiet. But my father intervened and said, I always told him to be like you. Still, I kept quiet because I wanted to have some points from him. Then he said, well, it's a good idea. Uh, then immediately I asked why.
Mm.
Very daringly, although I used to call him uncle only. But I said, why? Plastic surgery. Then he said, see, we see much less mortality because burn was with general surgery. And we operate from head to toe.
Mm.
So there are a lot of patients, lot of varieties, and there is no monotonicity therefore.
Right.
So, but, he said, but, and gave a pause. And then he said, but you have to be very good and perfect because our surgery is surface surgery mostly, and your results are seen from a distance, whether it is good or bad. So it has to be good. So now what do you think? Then I said, yes, if I qualify in MS and get marks, those days marks were given even in MS,
Mm.
and my choice will be plastic surgery. Luckily, in our batch of 14, I scored highest and in MS, and then I opted for plastic surgery. So that is how I initiated my journey in plastic surgery in 1976 in the first batch of MCH.
Right. So those were, sir, very interesting memories about Dr. Murari Mukherjee. I think
Absolutely.
no one has those memories as of now. Very
Yes.
few people would have had those memories as of now. But
Yes.
even after pursuing your MCH, you went ahead to PhD. So I think that's very rare in plastic surgeons. We have already spent in almost 12, 13 years, and not
Yes.
many people tend to go ahead and pursue PhDs. So what was the reason? How did it occur to you, and how did it help you actually?
Yeah. So actually, I am the third person to do PhD at that time. Colonel A.K. Banerjee did PhD, first PhD under M.M. Mukherjee. Second was Professor Matangi Ramakrishnan,
Acha,
who was my examiner of PhD also.
okay.
And third was mine. So what happened is that from 1981, I initiated my journey in research on flap, and extensively I got involved doing cadaveric dissection, dye studies, etc. And in 1989, Professor J.K. Sinha, my chief, he said, you are doing so much of original work and research and presenting in the forum of APSI and other forums. Why didn't you get registered for PhD? It
Mm.
never occurred to me before. So he gave me this thought. And then I, being a clinician, and I thought PhD, okay. And then I got registered under him and continued with my research. By that time, For PhD, lot of material was already in my hand, but that was not my motive to do PhD, and my passion was totally different of research on flaps. So that is how I got registered for PhD, and I got the PhD in 1994
Okay.
from Banaras Hindu University.
So you always talk about research. You have been a thorough researcher since the very beginning. Now, how do young professionals engage in both clinical practice as well as research and maintain high standards in both?
See, there is enormous material, clinical material. So there is no shortage of clinical work. But many a times we do not find the answer of our failures, even the answers of our success. You would not have expected a success and it happened.
Mhm.
So in both the situation, you don't really enjoy the success as well, because you do not know how you succeeded or next time whether the success will come or not. So I think workload is not an excuse for not doing research. In fact, workload should encourage research to the younger generation, because once they know the rationality of their failure as well as success, they can always find the lacunae of, say, failure, and then they modify, they try to understand, they do some research within their resources.
Mm.
It need not be a very high technologically advanced laboratory. See, the highest laboratory is here, the brain, your own brain. That has to think first,
Yeah.
and then the technology comes. And depending upon the availability of resources, you can always frame short term projects to start with.
Mm.
So it need not be a very elaborate project. It might have two parameters. And then once you get into this short term project and you find the result, and every time any research, first attempt does not give you the success. There's bound to be some failure, some mistakes, and then you analyze, and then you modify, and then try again that parameter. So this keeps on going. But once you succeed in this endeavor, then you find that yes, this is the rationality and this is how I can modify. And actually that improves his practice, improves his surgery, and he can speak about it on different forums, and it enhances his total image, because there is no point in doing good work and becoming popular in your own city alone. After you mature, say after 5 years, 10 years, then you feel that people elsewhere should also know about you.
Right.
Who are you and what is your contribution? So to start with, the short projects should be tried. There's enough clinical material. Only thing is you require little zeal and enthusiasm, encouragement maybe from your seniors. And then you venture into long project. And long project is that project which you take lifelong, for which you will be known.
No one. Right, sir. Sir, you might not probably remember, but I had presented a paper on the ulnar digital artery perforator flap cadaver studies. And
Yes,
after that paper, I had approached you, and that was a very sort of a game-changing moment for me. I told you, sir, how should I proceed? I have these problems. At that point of time, you told me, I'll tell you what not to do, and
exactly.
then you can learn from that and do what you should be doing. And subsequently, after getting those tips from you as to what not to do, how to avoid spillage of the dye, how to avoid soaking of the entire field, then my subsequent cadaver studies went really well. So as you said, you start with very small projects. That is what exactly you guided me way back around 15, 17
I
years back.
remember. I remember that moment.
Right, sir. So you talked about failures in research, and we should obviously take them in our stride and overcome them. What about failures in clinical practice? Because we all tend to have our own share of failures. Our flaps go wrong. How do we? Some are not able to sort of accept the failures very easily. How do you accept those failures and still move ahead efficiently?
Yeah. See, I think only that person do not have failure of flaps who has never done a flap. Each one of us have failed and modified. I remember that how my research in flaps initiated. Ponton described it in somewhere in July 1981. The fasciocutaneous flap called it a super flap.
Yeah.
So I read it in the journal. Those days went to the library and mobiles were not there, all this the internet. So went and found that, oh, it's a very simple solution for difficult problems. I used to get a lot of reference from orthopedics for distal leg defects, etc. So another that patient came, and I, along with my team, operated enthusiastically and designed the flap according to my suitability, without understanding the vascularity of perforator. Forget about perforators, even the main axial vessel. And the I thought that this is a very simple procedure for difficult problem, and ultimately the whole flap failed, except the random flap part
Okay.
and the proximal area. And my research mentor, one of who initiated me into the experimental animal research since 1984, Professor Ken Udupa, he was my supervisor of MS thesis. So he told me always to document the failures. I have that photograph with me today. And so I thought, what went wrong? All of us started discussing. I said, no, no, I have to read the article again. And when I went back, it was clearly written everything. Where is the vascular axis? What are those small vessels? He did not write as perforator.
Mm.
Small vessels arising in different directions, and they should be preferably incorporated, and need not be one. If there are small or large, two, three, four, incorporate all of them give some blood supply,
Right.
augment it. So then I understood it, and then I realized that good results come from experience and experience come from bad results. And then next time when such came, there were plenty of such cases. I was extremely careful. He mentioned about beveling of the incision, which I did not do.
Mm.
Whatever he mentioned, I just did not do. I did it like a orthopedic surgeon raising a flap or a general surgeon raising a flap, and with all respect to them. And then next time when I did it, I was very careful as I was reaching the pedicle. I kept it quite wide. After visualization of the perforators and the vessels and the main vascular trunk, then I narrowed down bit by bit,
Mm.
because that will allow me to move the flap to the distal defect, and kept it very lax. That point also you mentioned that there should not be kinking, etc. So, I mean, that article was in front of me in the operation theater. I kept that journal in front of me and asked my resident, now you read this line. What is it? I have dissected up to this much. Now what? And this I have seen being done by Dr. R. Venkatswamy when he was doing the dorsalis pedis flap. The tissue transfer book was in front of him and he was reading and doing it. I visited him at that time in 1981.
Mm.
So this is how I progressed, and so I think the documentation of failures are much more important than the documentation of success, because those who are working in the same field, you can tell them, don't do this. This doesn't work. Don't waste time and energy and mind on this aspect. This doesn't work. I have done it. So this is a great message to the fellow workers and researchers that this doesn't work,
Mm.
and then that is a more positive information rather than showing only good results.
Right, sir. So I think that is one of the important things, because you being one of the first generation plastic surgeons, you had to look into the books. Thankfully, we have our seniors, our teachers who had gone through those failures,
Yes,
and we are making some new failures of our own, and we are not repeating the failures that you people made. So what you
true.
said is perfectly right for our
Yes.
generation at least. So apart from research, you have been an active member of the APSI since over 4 decades now. Being you have been part of the APSI journey. You have been president. You are a trustee of the APSI. How do you think the APSI has evolved, and what can we do to make APSI further stronger for the current generation of plastic surgeons?
See, our generation has seen the evolution of the society, evolution of the flap from random to uh, free flap, and I have been doing all those
Yeah,
random to free flap. And our generation has seen advancement in technology, and therefore we have seen the evolution of our association.
right.
Earlier, there was about 160 or 70 members, out of which almost 110 or 20 used to attend the conference. So you see the percentage.
Percentage.
And most of them will come with their wives. And we got recently married at that time, and our wives were absolutely new, and chiefs' wives were used to behave like mother-in-laws. So there was a very nice collaboration. So this is how it used to. We used to attend the conference, and there was no other forum to present your paper of basically of plastic surgery. Now, gradually, we have seen that subspecialties started evolving,
Mm,
and almost now there are 12 subspecialties in our association.
yes.
And it started growing. It was a very good sign. It is still a very good sign. But I find that too much of fragmentation at this stage may not be that desirable, because then the group becomes very small, and then their forum of presentation also becomes very less. So the size is reduced. But super specialization is a must. It is happening all over the world, and we
Yes.
have to cope up with that. We have to present our work in different forums of the world, national and international. Therefore, I believe that super specialization of subspecialties is extremely important. It's a very important advancement in our specialties. We could realize those fields. But my only advice is that those subspecialties, people who are involved in, they should not get delinked from the main APSI, because they are doing under the banner of APSI, most of them.
Right.
And they can have their own conference, they can have their own journal, everything. But at the same time, they should be inclined towards the parents.
So they should not delink themselves from the APSI.
Yes. And in that endeavor, sometimes what happens is that you try to perform certain surgeries in collaboration with other specialties, totally different specialties.
Yeah.
And then you try to depend on them all the time. And that perhaps weakens our association, and we keep on grumbling on various forums. So why not those areas can be studied and learned by our own people, so that you make a team of your own plastic surgeons. You need not ultimately depend on others. I think this is the area where we should focus on.
So, but there are certain branches like oncosurgery, for example, orthopedics. Like basically, plastic surgery is sort of a dependent branch. These the patients which come to us, we are a problem-solving branch. The problems which they face, we tend to try and solve. So then, how do we address this
Yeah, they are different. They are collaborative branches.
collaborative?
They are different. They are collaborative branches. That means for the benefit of the patient, we collaborate with each other so that same thing can be done in one go.
Yes.
Earlier, during our days, the orthopedician will fix up the bones, etc., and leave it open. In a second stage, the plastic surgeon will be called. Or even in acute trauma, they may handle and they may call it us later.
Mhm.
That team approach should be there so that all the specialists are there and they discuss among themselves the sequence of management so that in one go they can give the whole thing to the patient, cost effective, less hospitalization, early recovery. So that's a collaborative teamwork.
Right, sir. So you are talking about hand, lymph, vascular, these type of subspecialties which are coming up.
Yes, yes, yes,
Right, sir. So now you have been in a lot of administrative positions as well, right from being the head of the department to president of APSI and numerous other administrative posts. So I think administration comes with its own bag of criticisms which everybody has to face. How do you face that criticism and still go forward? And how do not everybody is able to face that criticism and still move ahead?
see, the criticism are of two types, I feel, and I have seen. One is a optimistic criticism which comes from think tanks, and they give critical remarks
Mm.
to make you improve. So they are good people around,
Constructive criticism.
absolutely, and you adore them.
Yeah.
And there are people who would like to put obstacle,
Yes.
and you see, such people are powerless unless you react. So they can't fight against the wall. And so you make them powerless by not reacting. Even if you have to react, you just avoid and ignore.
Okay.
These are the two good weapons in administration. Don't react much and avoid and ignore and march forward. Because every person of such ideas have their limitations, have their boundaries. They can't go beyond it. They are basically weak people.
Mm.
So once they realize that this fellow cannot be stopped and he will continue and will disprove us in different forums, then they get discouraged and it bounces back. So I think the good constructive work makes your image and people around you know you very well, your personality, and they cooperate with you most of the time. So this was my way of handling them, and this I learned from Professor K. Udupa, the founder director. He was a multifarious person,
Right, sir.
and from my father.
Yeah, apparently he was a Sanskrit scholar, I believe.
Yes, absolutely. A
Quite.
renowned Sanskrit scholar, world authority on Srimad Bhagavad.
Who is it? Okay.
He received Padma Shri in 1989.
Acha. So nice. Sir, how do you define success being you have wore multiple hats, clinician, researcher, administrator, and whatnot? So, what is your definition of success? Do you consider yourself successful?
Yes, to some extent, nobody is fully successful in this world, I think. But I think you should have multi-pronged approach to your life. Success is not based on one parameter.
Mm.
And I find that uh, life is a piano, you know. It has black reeds representing sorrow moment of life
Yes.
and white reeds representing happy moment of life. So if you play only black or only white, no euphony will happen. Only when you play them together, melody will come out.
Right.
So you should have your a broad base lifestyle. You should have clinical aspect. You should have familial aspect. You should have social aspect. You should have hobbies to nurture with. So, and if one area is getting little weaker, the other area takes care. So when you move with all these, your success glimpses on you. You feel better. Yes, okay, could not do this, but I have done this. So you are never sort of down with your failure. So you can always overcome those failures and become as much successful as you are.
Right.
And my father used to chant a sloka, which from the beginning has been encouraging me, and I keep on repeating it whenever I have some problem. And I'll chant that slok. Charannai madhu bindanti, charan swadu mudambaram, suryasya pasya shremanu, yona tandra yatecharam. Meaning thereby, those who are constantly active and persevering avail the nectar of life with accomplishment.
Okay.
Look at the sun. It never tires from shedding its golden light on the universe. So you have to be constantly active and persevering and never leave. The roof is not going to fall on you.
Right. So basically, keep on working, make your mistakes faster, keep on
Yes.
working even in spite of
And
that
the, and
failure.
the other thing which I would like to mention about the younger people, that they should understand that life is like a river. It has many turns. So you must enjoy every turn. That means whatever phase you are passing through, you make best use of it because no turn returns.
Right.
So whenever you have an opportunity to listen to good speakers or good workers, be in touch with him and interact with him. You see, many people don't do it in the conference. They just don't identify them. But it is said that most of the people get wet in the rain, but only few feel the rain.
Yeah. If you enjoy the rain,
Feel the rain.
feel the rain.
Yes, others get wet.
Right, sir. So you have been talking about the significant part your mentors have played in your success. Even today, you talked about them. You talked about your father as well. So for the young professionals, how do they identify and select a mentor, and how do they make the most of this mentor-mentee relationship? Because it is
See,
not really easy to have a good mentor in your professional life.
absolutely. See, there are two ways to look at it. One is that the people with lot of wisdom and knowledge, they are attached to many institutions or even in individual level, and they are eager to find good students, motivated students to come to them so that they can disperse their seeds of knowledge. And on the contrary, as you said, those students are searching those wisdom people,
Yes.
people with full of wisdom. And when these two interact, the outcome is inevitable. It will all be all full of fruits. But if one tries to find out the qualities of a mentor, I feel that he should be a self driven, mission oriented, result oriented, disciplined person with a lot of flexibility to
Okay.
listen to others, respect the views of others, encourage discussion, tell them the importance of documentation, teach them how to say, I don't know,
Okay.
teach them how to say, I don't do, so that you should not spoil the case and then refer to it. If need be, refer to cases. I refer my cases of, say, brachial plexus to my student. I don't do brachial plexus.
Mm.
But I tell them, you go there, go to him, he will do better. Sir, you are such a senior, we have come with all faith. I said, no, I don't do this. He does much, much better than me. I'll give you his phone number, his place. If need be, you go there and contact with me, I will tell him. So, who teaches how to say, I don't know?
Mm.
And then that person should not be a monotonous man. He
Okay.
should not always talk of literature and academics and all that. He should be a part of fun with you at times whenever necessary. So he is a different person in picnic and he's a different person in the department. And if you are a junior faculty of him, then what I used to do is that I used to encourage every faculty to choose their own area of interest and develop. I won't thrust my views onto them.
Mm.
And ultimately, you create in your students the passion of working hard, the passion of getting into deeper and deeper into the understanding of the problem, either through research or through clinical. Let their mind flourish to modify the technique. They need not do whatever I have done, they should do more than me.
Yeah.
And I think this is how uh, I would find a mentor. And these should be the qualities of a mentor.
That was very, very insightful, sir, and thought provoking. Indeed, I think we should all strive to have those characters built within us. You have been a teacher to almost, I would say, 50 or even a bit more of MCA students, postgraduates in plastic surgery. So you have sculpted almost 50 plastic surgeons. So what do you feel most happy about being a teacher, about being a mentor to 50 plastic surgeons?
You see, most of them are in touch with me even today.
Absolutely, that is understood.
And I feel very happy that whatever we used to do together, and that is another very important thing which I have learned, is it's never I, it's always we. Because alone you cannot do anything. You need assistance. Even a ward boy, even a floor boy, even a lab technician, they're as important as you are,
Mm.
their contribution. So they have learned this we feeling, that means the team spirit. They have become very methodical. And whenever I meet them and ask them in the conference, how are you doing? Sir, we are following your instructions, sir. We have learned from you this and that. So we are continuing with it. So I even today I enjoy doing dressing myself. So they also do it. We used to do regular camps.
Okay.
They have learned how to do camps and even CME in those camps. They have learned how to disperse the image of plastic surgery in different forums so that it becomes popular. It is not synonym with with cosmetic surgery or aesthetic surgery. They have learned how to write papers, how to present papers, and they have in their mind some sort of academic inclination. And even now, many of them send me their manuscript for modification, their presentation for criticism and modification, and even some of them ask me, sir, I want to give dissertation to my MCA students, and these three things I have felt okay. What is your opinion? So even in deciding of the dissertation, they sometimes call. I feel very happy to give my thoughts in it.
Right.
And so they have acquired, and I could inculcate in them these basic qualities of any clinician to march forward and flourish. And they can't come out of it. Now
Mm.
it is impregnated in their blood.
Right. So basically, teachers enrich the life of students, but students also enrich the life of teachers.
Yes, that's the greatest satisfaction.
Yeah, yeah, yeah. So if you could pass on one, if you could identify of all these things and identify one guiding principle which you would like to give to the next generation of plastic surgeons, what would that be?
I think desire, desire to be good. See, desire drives the dedication, and you should be genuine in your intention. You should be a good man, and should face the challenges. See, changes are the rule of nature, or the challenges are the rule of nature, and changes are the motive of mankind.
Mm.
So challenges are the rule of nature. You can't do anything, and your motive is changes. So, but you can't change the challenges. You have to challenge the changes. So you have to be updated all the time.
Yeah.
And in this maneuver, whenever you need a team, without a team you can't do much. Whether it's a research or clinical work or social work, anywhere. And selection in the beginning of a proper team is extremely important.
Mm.
You can't dissociate one person in the middle, and that doesn't look nice.
Yeah.
So I always say that in team selection there should not be a mathematical man or a arithmetic man who subtracts, who adds problem, subtracts pleasure,
Mm.
divides attention, and multiplies ignorance.
So those should not be considered in the team.
So such arithmetic man should not be in the team.
Right. That was really thought provoking. And as you rightly said, the only constant thing in life is change. So change keeps on happening. If
Yes.
you think about your over 4 decades of journey in the plastic surgery fraternity in various positions, if you had to change something, if you had to do something differently, would you like to do something differently?
I find few lacunae in me, and which I should have done.
Okay.
One is that I should have done more of craniofacial surgery, more of microsurgery. I do microsurgery, I do free flap, but more of it, lot of modifications. And uh, I should have interacted more with the present younger generation, the teenagers, and the little more older people, because it is our duty to the society and to the family and surrounding, and in a very nice manner enter into debate with them. I want to enter into debate. I try to enter many a times, and tell them that whatever is new is not good, and whatever is good is not new. With this theme, I try to interact with them, and I want to interact more and more with them. Uh, since I belong to the city where Sage Sushruta stayed, practiced, innovated,
Yeah.
wrote, taught, so I want to make a presentation apart from those documentaries and some forum elaborate presentation about Sushruta.
Okay.
And lastly, I wanted to play sitar, which I could not learn. Still,
Acha.
still, I would love to learn sitar.
Okay. Right. You also, apart from these things, which you would probably, if you would go back in time, you could do these things. But if you see the evolution of plastic surgery over past 40, 50 years or so, what do you think is the most important thing which has evolved in the fraternity, in the specialty?
See, from a researcher's mind,
Yes.
I would first initiate. I think it was a great advancement when two random flaps were united to make a tube pedicle.
Okay.
The person who thought about it, you think about him,
Mm.
how innovative he was. He was struggling with the dimension of random flap and unable to do much reconstructive surgery. And then he decided how to enhance on the same pedicle a larger dimension of tissue. So when he united the two random flaps and make a tube pedicle, and then two tube pedicle into four, and so on and so forth. I think that was a great innovation and advancement to start with a very nice research mind,
Mm.
very evolving research mind. Because when I visited Professor R.N. Sinha's unit in Patna long back in 1979, there was full of tube pedicle in the ward, from head to toe, abdomen, like everywhere, even post auricular everywhere. And I was thrilled. I used to do tube pedicle, a lot of them. And examiners were asking about tube pedicles in detail on those
Mm.
days. But thereafter, uh, there is no end of evolution in every field. In flaps, we came to know about the perforators and the super flaps and the ultra thin flaps. All these are, as the understanding is growing, the
Mm.
the thought process of vascularity is going, all based on vascularity, blood supply, and the beauty and the blood supply is said by Gillies. So in this race, I think we have achieved a lot, but there is no end to it. I'll give you an example. I tell many of the microsurgeons who are doing regularly free flaps that I demonstrated live microcirculation in 2003, and it's almost 20 years plus.
Yes.
And I tell them that this is the microcirculation which is occurring in continuity with the body. That means whatever is the blood pressure of the body, it is working on it. Now, when you do a free flap and attach a small vessel to a large vessel end to end, or end to side rather, then the hemodynamics change. See, more blood is forced into a small vessel, and,
Yes.
thereby into the subsequent into the tissue. So I tell them that why don't you use the same model which I have made it, which took almost 1.5 years of thinking, uh, and then you do see the microcirculation in a pedicled flap, and then the same flap is detached on the perforators and attached to end to side to a larger vessel, and the same tissue is observed again,
Mm.
and see the change of the hemodynamics of a free flap from a pedicle flap.
Okay.
So it will be totally different, as I presume.
Yes.
More faster circulation with more force.
Yes.
So I have percolated this idea to many of the people relatively younger, that why don't you try this? It may take one whole operation day of yours.
Definitely. Yeah.
Okay, but if you could show and compare the same tissue under microscope as pedicle and as free, and
Mm.
see the difference in the circulation, it will be, a great revolution in the thinking and understanding. So
Yes.
all these areas, then the craniofacial surgery and all the experts are there. Even in burn, there are so much of understanding, so many things have evolved for the management of wounds,
Mm.
understanding of wounds and tangential excision, everything. And even in uh, aesthetic surgery. See, the our generation was, we were general plastic surgeons, as we call.
Yes.
We used to do everything. Even today, we do everything,
Yeah.
and more so because we have to teach our students, so
Yes.
they must learn everything, whatever possible. So we have to teach them. So we have to learn before that. For example, a lot of maxillofacial trauma used to come. Even today we do it.
Mm.
But those days, all these plates were not there. We used to use stainless steel ware for internal suspension or even figure of eight fixation.
Fixations.
And later on, we used to see that these figure of eights get loose and the bony fragments slice down little.
Mm.
So I went to a person and convinced for 3 years in Mumbai, who is not a plastic surgeon. And ultimately, he found that I won't leave him, and he taught me. And till today, we are very good friends. And then I told him, sir, I am not your competitor. I'm from an academic institution. I have to teach my students for betterment of the patients. So please teach me so that I can teach them. So
Mm.
like that, we made effort to learn ourselves first and then to the students.
Right.
So that is why we are general plastic surgeons and we have access to most of the areas.
You talked about your that landmark presentation, I would say, of microcirculation you did in 2003. At that point of time, it was way ahead of time. I think even now it is way ahead of time for most of us. So that's almost 20 years old now. And as you said, you have dropped in a few ideas for someone to take them
Yes,
further forward.
yes.
Is there anything which you are currently working on in terms of research?
See, now I am in a little bit of genetic study.
Okay.
So there is a department or Institute of Genetics in BHU, and we are working on that on the clefts and syndactyles, all anomalies, limb anomalies, and clefts, and vascular malformations. So what we have to do is that we have to draw the blood, go to them and try to do the genetic malformation in the at the level of the genes.
Okay.
And what is his implication? Because ultimately, in future, the gene therapy is coming
Yes.
in a big way. And once you know about the details of genetic disorder, then only you'll be able to initiate gene therapy. And so the head of the department is kind enough, and he finds a lot of material from me because he wants the blood from the patients. He doesn't have patients,
Yes.
so we collaborate with each other.
Okay.
And the other aspect is that we have incorporated the biotechnology research person.
Acha.
So he tells about how to deal with the uh, maneuver of the genetics of the genes. So he is in the same field, and so this team is we are working on this at present.
So still you are actively involved in research.
Yes, yes, I can't leave it. That is my passion. I can't live without it.
Right.
Some form has to happen.
It was very nice interacting with you, sir. Before we conclude, one last question I would like to ask you. Overall, you feel content with your life's journey overall till now, of your accomplishments, of your failures. For those who are struggling to find that contentment in their personal as well as professional lives, for those who are finding it difficult to have that balance between their personal and professional lives, what wisdom would you like to share?
Yeah. See, segmentalize your day and week. If you have several pillars in 24 hours to go to. Uh, Suppose in the morning you had a uh, hard words with somebody, and then you have to operate. So this first segment should not affect the second segment. People say the whole day is spoiled because of morning event.
Mm.
I don't believe in it. You segmentalize. That was a segment in your life. Next, you are operating in a cool brain. Then you are taking class. Then you have an administrative meeting. Then you have a social functional meeting. At night, you have an event, social event, and fun event. All these should not affect each other. The trick is, which I have learned over the years with great difficulty, that you segmentalize your day. Do not allow the effect of the previous one onto the next one. Otherwise, you won't be able to work. Whole day is spoiled, and
Right.
you have so many things to do. So we will not allow that. So that is the way I think one should do.
I think, sir, it is very difficult to implement.
No, it is not, because that should be your sort of habit, and that is your personality.
Right.
And whenever you feel very depressed, you go to nature,
Mm.
sit there quietly, talk to yourself, remember your parents, ask for their blessings, believe in God, and you will find most of the time the solution. So isolate yourself within the nature.
Mm.
Nature cools you down, and then follow some of your hobbies.
Yes.
And for example, I'm a sportsman, which gave me a lot of incentive of leadership, punctuality, and team spirit, etc. And uh, I sing songs, I recite poems, because I'm a student of Shantiniketan,
Actually,
Tagore's University. My schooling was there, and I do some shairi also sometimes, and I do drawing. So I think if you nurture these hobbies, that will cool you down. Don't get excited and disturbed. Your personality should be very strong, and these are the segments which will make you strong.
right, sir. Thanks a lot, sir. Thank you,
Thank you.
everyone, for being with us for this session of Candid Conversations with Dr. Visweswar Bhattacharya. And thanks a lot, sir, for this insightful conversations. And I'm sure we would like to have more research coming from you, and more inspiration coming from you for the younger generation of plastic surgeons. And thanks again, sir. Thanks a lot, sir,
I'm,
for joining us.
I'm thankful to you. I'm extremely delighted to talk to you and share some of my experience of life. Thank you so much, and all the best. Congratulations.
Thank you, sir. Thank you.
Thank you. Thank you.